Different method of heat loss is generally occurs on from the all the exposed areas. It means, and in all the mechanism of heat loss like evaporation, convection, conduction, radiation and respiration. Basically we don't take this into consideration, that is respiration. Skin loses the heat from all the mechanism, by all the mechanism, contact, conduction, convection or the evaporation, but the in respiration generally evaporation happens, or that alveoli, from the alveoli the fluid or the water is being evaporated with the air which is inspired and expired, and we get cold from inside also and outside also. This is another diagram, that means person is sitting, conduction is happening there, person is sitting, then the radiation is also happening from the head, evaporation is happening from the sweat, respiration, heat loss by breathing, convection, air is coming in the contact with the skin and taking away the air, taking away the heat, and all the mechanism is if a person is exposed in the external environment, heat loss is happening from everywhere. So we should be aware of that. That's why proper clothing is recommended. Sensorineural system stimulation and local cutaneous reflexes result in the vasoconstriction that we have already discussed, and shunting of the blood to the central pool, means it shunts the blood from the periphery to the central pool, so that the central part of the body is maintained with the general temperature. This vasoconstriction leads to for declining peripheral tissue temperature, which contribute to peripheral cold extremities. This is the condition which we will be discussing in the coming slide, that these cold extremities will shifting this blood from these cold extremities can lead to injuries to in peripheral regions. Blood flow is increased to the vital organs like heart, lung, kidney and brain. Heart, brain are more sensitive to the cold temperature, so the electrical activity of the heart is very much important for the conduction of the heart. So these are the areas where we need more blood. So the body tries to conserve the blood to these areas. If the body temperature continues to decrease, organs begin to fail and eventually death will occur. So it is simply a ongoing phenomena. There are different conditions which we will be discussing, that sign and symptoms of hypothermia. If 37 degrees centigrade, then no hypothermia, no symptoms. Below 35, which we considered is the point for the hypothermia. Definition of hypothermia is there, but the symptoms are generally none of the symptoms no appear. Below 35 up to 32 degrees centigrade, mild hypothermia. Then we have symptoms: shivering, lethargy, apathy, confusion, rapid heart rate. From 28 to 32 degrees centigrade, mild, moderate hypothermia. Then shivering stops from 32 or 33 degree temperature. Below that, shivering start, increased confusion or delirium, slowing of heart rate may become irregular to 28 degree, or sometimes heart stops also. So below 28 degrees centigrade, severe hypothermia, coma may intervene, ventricular fibrillation may develop, heart may stop, and person may appear diseased or lying cold and clammy. At 20 degrees centigrade, brain activity stops. If brain activity has stopped, so maximum chances is there, then the body's main regulation centers are also heat regulation centers are also stopped. So we person may land up or dead beyond that, and we will be. It is a highly miraculous condition to revive from there. So we will be mainly focusing if a person is around 28 degrees centigrade or 24 degrees centigrade, so that we can revive such patients. So we are having different degrees, but these are generally very less conditions in India or our setup, but we have this condition, so we can discuss it. The more the temperature decreases, body becomes cold, lack of coordination is there, shivering is there, confusion is there, urge to urinate is there. So we have a lot of conditions there. So we will be dealing with hypothermia with various conditions, and we will be diagnosing it by if we are having a thermometer, that is a rectal thermometer, which is very sensitive and designed for load reading. So we will be with bladder catheter equipped with a thermoprobe. We generally insert into the rectum and we try to take the temperature from there. Oral or real temperature are not accurate. We should not rely on this in case of hypothermia. Hypothermia treatment is we can say that we should be having very patience to treat such patient, and it is a very slow rewarming condition we should develop, and we should be very patient, and we should be monitoring all the heart conditions, monitoring all the brain activities, and very slow warming, and so that person may not develop the ventricular fibrillation or ventricular arrhythmia, and person may land up in deadly condition. So patient should be removed from the cold environment and placed in the warm shelter away from the wind. We should be remembering that if a chances of a person exposes chances of re-exposure to the cold condition, then the chances of revival and re-exposure will lead to further deterioration in the condition, and we should avoid that. If any wet clothing is there, should be removed and replaced with warm, dry covering, including head covering also. Shivering should not be pharmacologic, means should not be suppressed by drugs. Rewarming at the rate of 0.5 to 1 degree centigrade per hour is acceptable. It means we have to rewarm the person very slowly. Patient should be warmed gently because ventricular fibrillation is easily precipitated. We should be very much careful when the around 28 to 32 degrees centigrade, so that person may not land up in ventricular arrhythmia or ventricular fibrillation. And IV infusion should be given to maintain the plasma volume around 250 to 100 ml, heated 40 to 40 degrees centigrade, 5% dextrose in normal saline. This is the treatment protocol which generally medicine people follow. But if we, as a medical practitioner or the medical officer, we come to as a case of hypothermia, we can also follow that, and we should further read in on this. In case of we are a medical officer and treating the patient, we should further read on the text on the hypothermia management. This is one of the management. They were completely isolated and covered person with fresh clothing. This is a timeline which I have already discussed. So we can people can read from recall. Person can read these slides. It is a complete recall process and complete clinical protocol to revive the person. If a 36 degree person feels cold, 6 dry shelters, replace wet clothing, dry including socks, gloves, heat, hat, cover neck, insulate whole body including head from cold, exercise but avoid sweating, external warmth, fire can be, fire source can be there only if core temperature is above 35 degree. It means we don't have to excessively heat a person where there is a temperature is already below the 35 degrees centigrade. Warm sweat drinks and food of high calories can be given, but when the body temperature is below 35 degree, hypothermia, patient should be in the hospital. No external exercise, no generally no external warmth. Then person should be warm sweet drinks and sweet drinks and calories, and internal warming via warm moist air, exhaled air, steam, and warm moist oxygen can be there given. Muscle stiffness can be further treated by monitoring the pulse, breathing, restricting all activities, down with the feet slightly raised. So lie down and raise the feet so that person whole body temperature is, core body temperature is maintained. Then they come to the periphery. These are the various exercises of the limb elevation, all the above that. If the shivering stops, person collapse, then transfer the hospital to urgently. Semi-consciousness, nothing by mouth, check airway, airway should be remained opened. May tolerate plastic airway, but recovery put it in recovery position. Check airway, turn every 2 hours to protect skin. Monitor pulse and breathing. Show slow mouth to mouth breathing with victim's own rate may be very slow. Check airway, CPR with mouth to mouth breathing. Cardiac arrest is there. So we have to follow almost all the emergency protocol and should be monitored very carefully in a intensive care setup. Cold weather injuries. This is one of the localized. Will be discussing more. Hypothermia we have already discussed. Now the chilblain, trench foot or immersion foot. These are non-freezing injuries. Means the injuries are happening, but the temperature of the external environment is not freezing, means not below the 0 degree temperature. So chilblain is there when there is constant cold air is blowing. Then the person may develop a condition called chilblain. Trench foot or immersion foot, a person is wearing boots and immerse his foot in the cold water which is not freezing, so and constantly walking for weeks and long that, then the trench foot develop. Freezing condition, frostbite, frost nips, associated injury, snow blindness sometimes happens, eyes can turn to white also, dehydration can develop, carbon monoxide poisoning can happen sometimes in the closed areas. So chilblain, repeated chronic exposure of bare skin to temperature to 32 to 60 degree Fahrenheit. Symptom is there. It appears as a swollen tender papules on the skin, complaint of burning or prickling sensation and redness. Treatment is passive warming at room temperature, no rubbing, and protect from trauma and secondary infection. Generally no injury can happen, but person may be going into the certain conditions also. So may be going through the pain and all that, but generally trauma doesn't happen. So chilblain is a exposure to the conditions like Trench foot, immersion foot means exposure with the cold water in certain condition. Wet condition, low temperature, prolonged contact with moisture at between 32 to 50 degrees temperature. Signs and symptoms: numbness and pain, swelling, tingling and itching can happen. Pale and waxy condition can be there. Blistering can happen. Treatment: elevate, wrap in loose dressing. Passive rewarming at room temperature. No passage of rubbing. No rubbing and air dry. No immersion in water. So trench foot is also a condition where there is no injury happens, but we have to treat it. So medicine people generally take these cases, and we are generally reading it because this can lead to further injuries also. Then frostbite is main important thing for us. Frostbite is first degree injury. Frostbite, partial freezing or stinging. Second degree injury, blisters, numbness and burning pain. Third degree, blue-gray discoloration, blister forming. And fourth degree, blue or deeply aching, and then it can lead to further injuries like amputation or further there are chances that the whole of the toes and the digits of the lower limb or the upper limb can drive and gangrene out. These injuries then they can be counted as injuries, and if it is exposed by deliberate means, then the person is liable for compensation, or for the person may file a criminal suit also. So frostbite, first degree of frostbite is most superficial form of frostbite, no permanent cerebrovascular injuries. Sign and symptoms: redness, mild swell, pale and edema. Treatment: warm immediately. Frostbite, true freezing in injury of the tissue. Onset is signaled by sudden blanching of the skin of the nose, ear, means there is sudden contraction of the skins below skin of the nose, or blanching means there is slight paleness or slight areas blanching. Cheeks, toes, followed by tingling, means there is a slight sensation is there. Frostbite has declared itself when the areas are painless. Then after tingling, it goes to painless condition. Intense coldness followed by numbness. Numbness is there. Then second degree is superficial, entire epidermis is lost, skin redness is in fair individual, grayish discoloration is dark in dark skin individual, clear blister formation in 24 to 36 hours followed by sheet-like desquamation, and desquamation will lead to further cold sensitivity, persistent cold sensitivity in the area. We will be having a third stage or the fourth degree of the deep and fourth degree or deep loss of sensation, complete loss of sensation with pale yellow, waxy, if unwaxy, with waxy condition like this. Sometimes waxy condition like this happens. And third, poor capillary refilling, means there if the blood supply is re-maintained, then there is chances of poor capillary refilling. Tissue loss can happen, means the gangrene can develop and digit toe can be lost. Hemorrhagic bully can develop in the third degree at 12 to 35 hours unless rewarming in rapid. Red discoloration can happen 1 to 5 days after injury. 4 degrees characterized by gangrene, which I was talking about. Gangrene can happen, serious necrosis can happen, and auto amputation can happen. And these are the conditions where we, as a forensic people, come that we have to categorize the person that there is a serious injury, grievous injury, or there is a deliberate exposure to the cold condition, or the person has developed some morbidity, so that we can calculate the morbidity or disability from that permanent anatomic dysfunctional loss. So there we have a lot of the things going on there, and we can be doing that. So there should be a proper documentation of the injury, proper documentation of the history, and the history of traveling, history of exposure working in the factories, and deliberate and non-deliberate exposure of the injury, exposure of the extreme cold. And these all condition needs to be evaluated, especially in our setup. Generally, it happens in the industry where the extreme low temperature is being utilized for productions or something like that, or somebody is working in the hilly areas, then he can encounter the patient with these frostbite and gangrenes, and these can be evaluated and further analyzed and categorized as required. So we will be discussing in furthermore in the coming lectures about the frostbite and about the injuries by the thermal injuries. So frostbite treatment we can be there. The rapid rewarming temperature, here we can do rapid rewarming slightly above body temperature in the single most effective treatment. Rewarm until the skin is pliable. No dry heat, stove or campfire. No rewarming with exercise or rubbing. Do not rewarm in the field if there is a risk of refreezing. That's why I was telling you that if there is a chances of refreezing is there or re-exposure to the cold temperature, then we should not rewarm it, because if suddenly there is we try to warm it, then it goes to further freezing. There is a chances of more injuries as compared to the previous injury. Protection from further injuries, pad all the affected areas, loosely wrap with gauze and elevate the limb, remove wet or constrictive bandings, constrictive clothings. Any cloth which has constricted that area because of the swelling, we should remove that, and we should be very much exposed to that these surroundings and condition, and we should be very much be aware about this because this frostbite, we can see there are gangrene is already developing here, and these are the condition here. If we don't take proper measures as proper time, so maximum chances are there these digits can develop gangrene and self amputate, or we have to amputate that, and we have to be worried about these things, and we should be worried about this for saving of the limb or saving further mobility or disability. Thanks a lot with this, and we will be continuing about the further types of the burn injuries in the coming lecture, and we will be going through that in the coming few series, so that we will be having a constant exposure, or we should be having a constant scenario or outlook over how the injuries happen, how we can prepare the injury reports and all that. Thank you very much.